Good morning. What's on my mind? On behalf of Patient Choice in Chemin, Neuf, Pointe, Michel, I'm Dr. Dangleben. I would like to change gears a little this morning. Yesterday I spoke about trauma care. Today I want to talk about, how to improve your diet. And again, that comes back to controlling your sugar and your blood pressure that I have spoken about in the past. And eating well is one of the most powerful things that you can do to manage diabetes and high blood pressure, right? And eating better doesn't mean that you have to give up all the good flavors and the culture that we used to, right? But we have to make smart, consistent choices to improve, right? What we're going through medically, and also nourishing the spirits. That's important, right? So what to eat, what to limit, how to build sustainable habits, right? And get better, right? So a balanced meal using the plate method, and I'm gonna get into that. I printed a copy today. That's from the American Diabetic Association website, right? You want to divide your plate in this manner. You want to do half a plate, like you see the beans and the carrots, right, of non-starchy vegetables, right? So, you could have cabbage, carrots, spinach, broccoli, and then the quarter plate. You see the quarter plate? There you have a chicken breast, which is lean protein, right? You could have fish, you could have beans, you could have tofu, you could have eggs, right? And then the quarter plate, you could do starchy foods. You could do the potatoes, sweet potatoes. You could do quinoa. You can do whole grains, right? And if you want to add any oil or anything like that, stick to olive oil or avocado oil, right? Drink water or unsweetened tea, okay? So this is important, all right? I'm going to have a few of these available at Patient Choice in Chemin for you, all right? You have to start getting into certain types of food, right? Collard greens is not, callaloo. Let's stick with that. Spinach, okra, we have these things. Cabbage, eggplants, right? These things are high in fiber and potassium and low in carbohydrates, which is an offending agent, right? Fruits, you want to do that in moderation, all right? I mean, I love my mangoes, but do it in small servings. I know it's hard, right? But again, do whole fruit or blended fruit, over processed juice, right? We have oranges, we have berries, we have mangoes, we have papaya. Enjoy these things. If you want to do whole grain, you think of quinoa, right? If you want to do a bread, you think of whole wheat bread. Not a lot of that, right? You can do brown rice, you can do some oats. This is provide fiber, right? And bulk for your intestine, right? And it really does not spike your sugar as most people would think, all right? And if you're going to do protein, you have fish, you have mackerel, you have sardines. These things are really, good for muscle, right? If you're going to do chicken, we do a lot of chicken legs and a lot of chicken wings, but you could do skinless chicken and especially chicken breasts, right? And in terms of the fats, you can do raw nuts and pumpkin seeds and sunflower seeds. You could do olive oil. Avocado oil is a big thing now. I use a lot of that, right? And you could think of the plant-based milks now. I know it's almost, counterintuitive, but you could do almond milk, soy milk, low-fat yogurt. That can replace your dairy, right? And these are low-fat. All right. So these are important. Now you wanna avoid certain foods. You wanna avoid processed foods, the refined carbohydrates like the white rice, all the pastries, the cakes, white bread. I'm not saying you can't treat yourself once in a while, but if you cut out things like white bread and a significant amount of what you eat, if daily, then you will see a difference, right? The sugary drinks and snacks, that's that's a big one in terms of spiking our sugars. The sodas, the really sweet fruit juice, right? Candy, we need to pause back on the amount of sugar that we put in our sorrel and our passion fruit juice and tamarind juice, etc. All right, these things cause rapid sugar spikes and weight gain, and I think that is the problem with obesity that we're seeing. Fried foods, we love our fried foods. It's tradition. We go for the fried chicken, we go for even the plantains, the akras and things like that. They're fried, so they increase, cholesterol and blood pressure. Right? I mean, I'm not saying that you can't treat yourself a couple times a month, but watch these things. The salty foods, all the canned goods, man, all of them. The salted meats, the bouillon cubes, the chips, and sodium is the culprit in terms of raising blood pressure and straining the kidneys. All right? A lot of processed meats, the bacon, the sausage, the ham, all right? Even saltfish. I soak it overnight. Then I boil it. Get the salt out, as much of it as possible. All right? So if you want to really just focus on healthy eating, baking, grilling, steaming, or even this light saute instead of frying, right? Use herbs and spices. Use your thyme, your garlic, turmeric. All these things gives flavor, and that will reduce the amount of salt that you need, right? If you're going to do canned beans, I usually rinse all that out. Okay, get all that fluid out of there, rinse the beans out, get as much of that sodium and other things out of there. But again, I would prefer you use, dry beans or fresh beans, plant your own. All right, so that's important. All right, and you have options, right? Even the amount of coconut milk. Coconut milk is good for you, but you want to limit the amount. If you want to use an oil, use olive oil or avocado oil. You could use some coconut milk and coconut oil for flavoring, and that's okay. All right, but again, it's about you thinking about these things and making these changes, and going from there. All right, see what you have, work with what you have. We think that the processed foods are better for us, but they're not. Okay, and even up here we work, and we skip meals and we overeat later in the evening, and all these things are not good. So habit is one thing, right? So just a general thing on eating and controlling your blood sugar, controlling your blood pressure, right? Hydrate properly. Drink 6 to 8 glasses of water a day. All right? And that does not mean sugary drinks. That does not count as a glass of water. All right? Get into the herbal teas, unsweetened. All right? You can do the infused water now in those bottles. And the big thing, and for me, that's my biggest thing, portion control. All right? Portion control, understand that, and how you go about it. What's a serving? What's a teaspoon? Right? What's a cup of rice? All these things are important. All right? If we stay consistent, we will do okay and improve our health. And remember the plate options. We will have some of these available at Patient Choice in Chemin. I'm Dr. Dangleben with your daily tidbit. Have a great day. Peace.